Voluma for cheeks. Is it worth it? Will my cheeks sink after the Voluma dissolves in a year or so? I'm 38, considering Voluma for my cheeks before my wedding. I currently have an appointment 6 weeks before the wedding. I don't like the line in my cheeks. I do not want to look different or like I got work done. I just want to look not so tired. Is it worth it? Or will I just look like I had filler? Also, when the filler dissolves, will the line in my cheek be even worse because it was filled and then hollowed out after the product dissolves?
Thank you for your question. You submitted your question with a single photo of you smiling, and you're stating in your question that you're 38 years old and at about 6 weeks before your wedding you're planning to have some voluma placed in your cheeks, and essentially you want to address some lines in the cheeks. At the same time, you're concerned about it looking natural, and you're also expressing a concern about the cheek looking more deflated when the voluma gets absorbed or broken down by your body. Well, I can certainly help you understand this type of question, which comes up in our practice pretty much every day. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I use Juvederm Voluma as well as many other hyaluronic acid fillers in my practice every day. And we actually perform a lot of procedures for cheek enhancement. So I'll help you understand a little bit about your concerns. So to begin with, at 38, and since you did submit just a photo with you smiling, it's difficult to assess what the face looks like at rest. But understanding that if you have an interest in addressing cheek volume, chances are when your face is at rest, there is some volume loss. So what I try to help my patients understand is when you are doing a procedure to restore volume in the cheeks, well, that's what you're doing. You're restoring. You're not necessarily augmenting. You know, there's a very big difference between taking someone who has already full volume in their cheeks and high cheekbones and then augmenting, because I mean that's an augmentation. I like to think of it when we're talking about restoring volume and maybe enhancing as more as a correction. With that understood, you can appreciate that it is unlikely, if you're going to stay within a limited amount of correction, that your skin will stretch out. And I think that's probably what concerns that patients have expressed to me. They're concerned that once they start having fillers, that, quote, they'll always have to keep doing them, and they're afraid that if you stop doing them, that they'll actually be worse off than when they started. Well, the reality is that you don't stop aging, and depending on the genetics and other factors that are more environmental, such as cigarette smoking, diet, etc., you will still continue and time will march on. But as far as being overstretched, it's not likely. I think that and if you're wondering if it's worth it, well, I think when you meet with your doctor, and this is basically my process. What I do is I'll take pictures of my patients from different angles and show them what they look like when their face is at rest. Because that's what we're treating. We're not treating a face that's moving, we're treating a face at rest. And so when we do that, especially when we're talking about cheeks, it's very important to understand exactly where the volume needs to be corrected. We do a procedure called Structural Volumizing, which is a very elegant approach to enhancing cheek volume. And the reason is that when we think about volume loss, we're basically thinking mostly about bone as well as some fat volume. And so when this placement of a filler, such as Juvederm Voluma or Juvederm Ultra Plus, is at the bone level, then the cheeks actually look structurally more defined, and they're enhanced to the level where they look natural, and at the same time they don't add weight so that you avoid kind of that chipmunk look when you get filler placed just under the skin. So for me, this technique really ensures for my patients the optimal appearance that looks natural, which then gets to the point of really the art. The art of placement, the art of the vision of what you have as far as an outcome and what your doctor has is very important. When we do cheek volume enhancement, and after I'm done, and my assistants and I always have this back and forth where we want to be sure. While I'm placing it from one angle, I ask my assistant what do they think from another angle, and they've all worked with me for a long time. We have this really nice dialogue. Once we get the right volume correction and we like it, very often the patients look in the mirror and they're just thrilled and they really love that. So I'm certainly very much a proponent of restoring a youthful, nice look by the right volume in the cheeks. But I think that this is a discussion you should have with your doctor to assess what is a good correction. I always tell my patients that it's better to undercorrect than to overcorrect, and so we can always add, which means that I usually have my patients come back after 2 weeks to reassess them. In terms of concerns about bruising, well, with structural volumizing, through the techniques that I employ, basically bruising is really not an issue. So the bottom line is discuss these concerns with your doctor before you move forward with the injection. Understand that a limited amount will not overstretch the skin, but that normal facial aging does continue, and you'll decide as time goes on whether you want to continue. So I hope that was helpful. I wish you the best of luck. Thank you for your question.